and welcome to today's webinar, What's New to See with the Big Three, a viral review of FeLV, FIV, and FIP, sponsored by Zoetis and powered by the American Association of Feline Practitioners. It's part of our Perfect Your Practice program. My name is Matt Bubala. I'm so excited to be moderating today. There's our QR slide. Please take a picture of that. If you are not already part of Perfect Your Practice, we would certainly love for you to sign up. I have a few housekeeping items to cover about the program and the webinar platform. If you have a question for our speaker, please send it through that chat button that all of you have been using at the bottom of your webinar panel. You may send in your questions at any time during the presentation. We'll do our best to address them if we have time during the presentation, and certainly we'll do some Q&A at the end. A follow-up email with your CE certificate will be sent within 48 hours of the conclusion of tonight's webinar. If you do not receive that email, please check your email spam filter. And as you exit today's webinar, you'll receive a follow-up survey. So please be sure to complete the survey so we can best tailor these events to fit your needs. Also, as I mentioned, we're going to be doing some polling with you during this event. So be ready for some of those to pop up on your screen and to answer when we get to those as well. All right, everybody, I would like to introduce you to our presenter for this evening. If you're already part of our Perfect Your Practice program, you'll be getting emails from her each week. Dr. Natalie Marks is my good friend, an amazing mom, a nationally renowned veterinarian, and the former practice owner of Blum Animal Hospital here in Chicago. Hello, Dr. Marks.
Hello, Matt, and hello, everybody. It sounds like we've got a nationally recognized audience tonight, so I'm really excited to be with all of you. Thank you for choosing to spend an hour of your time, which may be, of course, where you're sacrificing time with family or hobbies or anything else that's outside of work. So we really appreciate it. And as Matt said, we'd love for you to be part of our community, Perfect Your Practice, sponsored by Zoetis in partnership with AAFP. It's really practical tips and tricks on how to just do better medicine, better behavior, and just have a better experience dealing with clients and also with your team, making your work culture just much more cat-friendly.
And we're going to do polling questions, as I mentioned, throughout the night. So we want to start with a simple one. I'm going to launch a poll right now that should be popping up on your screen. So please jump in there and answer and just let us know who we've got with us tonight. Are you either a cat-friendly certified practitioner or part of a cat-friendly certified hospital? We'd love to know what we've got out there. Well, you give everybody a chance to answer that. Dr. Marks, you were a practice owner here in Chicago for over 10 years. Tell us about your cat-friendly status.
Well, I started as a certified practitioner and then recognized how much it changed how I practiced. And we ended up becoming a certified hospital. And I think if the nice thing about AAFP options here is that if you feel like you're on an island, you're like, I am the lone cat lover, I'm the lone cat advocate or catvocate, however you want to call it at your practice. And excuse me, you're championing for all these patients on your own, you can still do the certification as a practitioner, and that really does allow you to elevate how you practice and hopefully role model and sort of osmotically get everybody excited. As a cat-friendly hospital, you though have the ability to really provide a lot more education for your team, all levels of your team, and it gives you a lot more resources. So both are great. Maybe you do one and work up to the other, but certainly curious to see how many out there are part of the cat-friendly program.
Yeah, so what's coming through right now is that only about 18% are either cat-friendly certified or a cat-friendly practice. So we've got a lot of people that need to hear a little bit more about what you've got going on here tonight.
Yeah, lots of opportunities ahead. So this is exciting. I mean, I always start with kittens because who doesn't want to see this when you walk into a first exam? Can you imagine if this was your first exam of the day? I mean, I just melt looking at these little guys, and certainly I'll admit that the mush factor that I'm sure we're all getting right now is the same one I got. And unfortunately, the one thing that did do is it made me miss some of that valuable time slot that I had with that cat caregiver, that cat parent, and really educate them, especially when it came down to viral disease, because I'd be snuggling and sort of lose track of time. And then you really lose the ability to capture them a lot of times in that first appointment. But what about this scenario, right? When we have a potentially upper respiratory kitten that comes in, or even an adult cat, does this really common presentation of a kitten who is ill trigger you to start thinking about testing for viral disease? So does it trigger you every single time you're testing, or okay, is it half the time you're testing? Or let's be honest, right? Is it only when we remember to test? I've been in all those scenarios. Certainly, I started with just when I remembered to test and tried to work my way up. But the goal of tonight really is for us, oh, I'm so sorry, is for us to think about how we can really understand a really good foundation on these three feline viral diseases, but also understand the prevalence. How often do we see these diseases, and how often, again, does testing data actually show what the prevalence is? Is that even underestimating? And then we're going to go through diagnostics and a little bit of treatment in regards to feline leukemia, feline immunodeficiency virus, or of course FIV, and feline infectious peritonitis, FIP. And then we'll follow up and finish with the updated vaccine guidelines, which I think are really critical part for us to end, because of course, the core of what we do, especially in our new kittens, is prevention strategies. And that might even make some of this diagnostic testing a bit of a moot point if we can really get a lot more herd immunity, so to speak, within the felines at our practice. The other really cool part of tonight is I'll have some guest appearances by Dr. Sam Evans, who's a boarded clinical pathologist, as well as a PhD expert in feline viral disease. So she's going to join us and pop in a little bit with some recorded tidbits that are really important in regards to feline leukemia testing, as well as FIP testing. You know, obviously we're all joining in tonight probably with some of the same questions around what do these tests really mean, and when do I test, and with what test, and how do I interpret that? So that's going to be part of our goal tonight. So let's start with the prevalence of these three diseases. And Matt, I'm curious to sort of see what everybody's seeing in their practice.
Yeah, the next polling question that you should have up on your screen now: which of these three viral diseases do you diagnose most often? Is it feline leukemia, FIV, FIP, or have you said, hey, I haven't diagnosed any of these in over 6 months? Dr. Marks, I guess while everybody's getting a chance to answer, my question for you is, how hard should we be looking for these diseases?
Well, I'm so glad you asked that, because as we'll see in the prevalence data, remember, prevalence data is simply from collecting test results. But as we know, with a lot of infectious disease, and I'm sure people could be thinking of, you probably have 5 that even come to mind right now. The only way we really know the true prevalence of disease is by thorough testing. And unfortunately, retroviral testing is sort of hit or miss depending on the practice and depending on your protocols in the practice. I think a lot of people used to just say, I'm going to test at the first kitten visit. And as we'll go through this, there's some validity to that, but certainly there's also some confusion around that. And there's also lots of other scenarios when we should test, and even some when we shouldn't. So I think I'm really curious who is seeing what and what you're actually looking for, because that's really the key with these diseases. Is if we're not testing and not looking, just like with anything, we're not going to see it.
Well, so far, FIV is the winner. 42% are saying that's the one they diagnose most often, followed by feline leukemia at 30%. FIP only at 12%. Actually, I haven't diagnosed any of these in 6 months, coming up higher at 16%.
Oh, interesting. Okay. Well, I'm curious, if you answered, I haven't diagnosed any of these in over 6 months. I'm really curious to know, is that you're testing frequently and it's all coming up negative? Or if you're like, gosh, I really, now that I think about it, maybe I'm not testing that frequently, throw that in the chat and we can certainly talk about that later. So let's go in and let's start with just some of this prevalence data. So with feline leukemia, we know that it's quite variable. It's 2 to 3% of cats in some studies, up to 30% of cats that are positive in high risk or ill cats. Now, you look at that and you're like, so what's the actual prevalence? And that's part of the problem, is we don't know, depending on the study and the data collected and some of just the surveying and some of the market research data too. But we know that leukemia has 2 forms of transmission. Horizontal transmission, of course, means that we're transmitting through grooming and sharing food bowls and fighting, which is quite easy to do, especially in a multi-cat household or group housing scenario. And vertical transmission, certainly, as we know, is through infected queens from when they're in, obviously, in the very young age of life. FIV, though, is right now the prevalence is showing about 2.5 to 5% of healthy cats are infected with FIV. And we know that for FIV, the main aspect of transmission is mainly through bite wounds. And certainly that's no surprise, right? Because we think of these cats as sort of that outdoor tomcat that's been kind of scrapping in the alley, or that's been brought into a shelter with some kind of unknown history, and has a little bit more difficulty, right, in transmitting. It's not as easy. It's feline leukemia. And then finally, FIP, in one study in JAVMA, there, at a teaching hospital, it was estimated that 0.3 to 1.4% of feline deaths was from FIP. And the big thing that we know about this disease is that young cats, typically less than 2 years of age, are most vulnerable. That's really important for us for two reasons. One is this is, of course, the time that we're seeing a lot of those kittens. Thankfully, those cats most frequently is in the kitten series and even at that 12 to 14 months of age. So if we're not talking about this disease with them, we're, again, really missing a critical opportunity. The other thing to remember is that if they're most vulnerable, that also means that this is the time that we probably are going to be testing more often. So that's why it's really important for us to really understand what each of these tests are and the benefits, and certainly which one we should be using when. There are a lot of risk factors for FIP. And again, these we really should be not only teaching our teams about, but also clients that have risk factors in their immediate environment. Group house cats, those young cats under 2 years of age, sex and neuter status, and certainly some of the breeds that are more prone to this. Stress is a huge thing with FIP, as we all know. And then if they have a concurrent retroviral positive status. So if they are FeLuc or FIV positive, and again, if we don't know status, we certainly can't help decrease the risk potentially of FIP. So we're going to start tonight with the first of the three diseases, with feline leukemia virus. And again, just to kind of get a sense of the room, let's ask another polling question.
You know, Dr. Marks, real quick, I've had some really interesting comments come in. Alexander, folks decline testing healthy pets due to cost. I always recommend testing. Alexis, I offer testing for kittens and recommend recheck in 6 months for FIV, FELV. Recommended it a lot, but it has declined very frequently, unfortunately. And Kathleen, I've treated over 250. Yes, that many cats with FIP in the Metro DC area. The age spread is much different now than it used to be taught. So.
I would agree. Yeah, and we certainly see it, right, at any age. But when I say they're most vulnerable, certainly from studies, we know that that age group is sort of overrepresented. But I agree with you, Kathleen, I hope it was Kathleen, that said that it's certainly all ages. And we'd love to hear more. And certainly with your history of treating so many, as we get into the FIP section, please feel free to jump in the chat. We love the community.
Okay, our third polling question is up. Do you test a kitten at 8 weeks of age? And if so, do you trust the results? It's just a yes or no, but do you test a kitten at 8 weeks of age? And if so, do you trust the results? Dr. Marks, explain to me why you would be questioning the results.
Yeah, so remember, this is around feline leukemia specifically. So I think, as we know, right, feline leukemia test status is quite fluid. And as we'll go through this, we know there are 3 different types of infective states or stages, however you learned the terminology, both are correct. And as we look to see what that virus is doing within the body, if we're testing too early, and that's as one of our colleagues mentioned, they try to have them come back at 6 months, and I'm so glad you mentioned that. We know that sometimes testing too early can give us a false negative, and we can have sort of a false assumption that kitten is retrovirus negative. So I'm curious to see if people are saying, yes, I tested 8 weeks and whatever I get, I fully trust in, or I'm not sure, or I definitely don't and I want to retest.
So the yeses are at about 33%, the no's at 53%, and the unsure is around 14%.
Oh, interesting.
But there's a lot of different answers coming through the chat on how they do it, the ages, and the trusting of the results. So there's a lot of variation.
Awesome. So let's kind of go through this together, because I think this is really critical for us to talk about. So with kittens, right, and especially we're talking about with kitten parents or cat caregivers, often we, as I'm sure many of you feel the same way, you get a feline leukemia positive diagnosis, and all of a sudden our head goes to the place, this cat's going to develop leukemia or lymphoma, and it's a death sentence. And when I was in school way too many decades ago, that's what we learned, right? But thankfully, as we really get a better understanding of this retrovirus, it's not always the end of the world. And we, as practitioners and technicians and teams, it's really critical for us to understand the nuances of testing so that if we are getting a result and knowing that, again, the pathophysiology and sort of the disease course, we don't trust the result, we can walk this client, this cat caregiver, through the testing guidelines in a way that they can understand it and hopefully be more on board. Obviously, if budgets don't allow that, it's one thing, and certainly access to care is a concern. But if it's a client that is declining due to lack of understanding, hopefully this section will help with that. So as we walk through this, let's first start with point of care testing, which everybody's used to. So the point of care feline leukemia ELISA test means that if we have a potential exposure in our patient to an infected cat, we are looking for the presence of feline leukemia P27 viral antigen. That's what the test is actually looking for. And once a patient's exposed to that virus, they will become infected most likely and have a viral antigen positive load, meaning it will show up on a test most of the time by 30 days post-infection. Now, there are some exceptions to this, and that's why, again, any questionable situation needs to be reevaluated over time, longer time periods, like retesting 30 days from then, or with additional lab testing. And we're going to go through the Quant PCR in a second. But the one thing I want to stress about this is many people will ask, I work with a shelter who wants to sort of pool blood from a bunch of cats and just get a sense of the community. Can I do that? And strongly recommend that the answer to that is no. Really, the mantra is one cat, one test. And that's, again, because retroviral status here is so fluid and can be different cat to cat. So if we're pooling and one cat's got, a positive IFA, this one's got a negative PCR, and it's all over the place, we're not going to be able to really get a good sense on that. So don't pool samples from cats that are in shelters or group housing. It's really got to be cat to cat. So if you're not familiar with the AAFP feline retrovirus testing and management guidelines that were put out in 2020, strongly suggest that you download those. These are going to be referenced a lot in there. There's a lot more information and toolkits as well that we don't have time to get into tonight. But one of the great things about that is we can look really at this transmission principle for feline leukemia. And I'm going to break this apart into the 3 stages: abortive, regressive, and progressive. So hopefully it makes a little bit more sense rather than just kind of jumbo through this whole life cycle in one whole step. So remember, from the time that the patient is infected, and this can be the infected cat is shedding through saliva, respiratory secretions, urine, milk, and feces, to an uninfected or naive cat, it's about 30 days until we can start testing, and that's at horizontal or vertical transmission. But if we kind of zoom in and look in this abortive infection, the really way to categorize this is that there's a negative test result, right? Because these are the cats we're like, yes, great job. They've been able to eliminate that virus. The only indication that this patient has been exposed to a feline leukemia transmission or infection is because they have the presence of antibodies. But we are not going to be able to find the presence of antigen or viral RNA or proviral DNA. So any of that, again, intracellular kind of findings and sort of life cycle of this virus is not going to be positive tests. We're only going to see that there was a presence of feline infection because of the antibodies. This is not actually reproducible or common after experimental infection. It is more common just naturally occurring in the field. So again, what we have to think about is an abortive infection means all we're going to see is the presence of feline leukemia antibodies there. Now, if they aren't clearing, right? So if they're not eliminating the virus, what ends up happening is after that initial viremia, the virus is going to enter a lot of those immune cells like lymphocytes and monocytes. They enter the circulation and they distribute to a lot of different other organs in the body. We end up then with those cells kind of getting into those bone marrow progenitor cells. So those are the monocytes, the granulocytes, the platelets. And that's when we start seeing all of those high viral RNA and proviral DNA loads. And don't worry, if you're not familiar with that section, I will get to that, I promise. But I want to get through these life cycles first. So then we have what's called more of a regressive infection. What's happening here is that viral shedding is not occurring, right? This is not a cat that is shedding virus from respiratory secretions or from milk or feces or any of the ones that we just described, but the virus is integrated into that cat's gene pool. Okay, so what that means is if we are using this cat as a blood donor, it could transmit infection. So again, if you have a blood donor cat at your hospital, I'm sure you are consistently retroviral testing, but if you aren't, make sure that's on your checklist because that's a very important piece. Thankfully, these cats, although it's integrated in the genome, they have a very low risk of developing the feline leukemia-associated diseases we think about, mainly the oncogenic part of this. And there is, though, a very small risk of reactivating the virus to that last part, which, of course, is the one that we are least inclined to want. The integration into the DNA can lead to lymphoma or bone marrow suppression, but not as commonly as the one that we're going to see in a minute, which is that progressive infection. And this progressive infection, I kind of think about as sort of worst case scenario because it actually went through a second viremia with infection of epithelial cells. So not only did this patient, again, if they didn't clear it with the abortive and it went into the genome and those regressive cats are sort of hanging at bay, now it went through the second viremia and now we're in this progressive kind of forward moving kind of stage of feline leukemia. So it's not contained in that earlier stage. We have a lot of viral replication in the lymphoid tissues and going into the mucosal and glandular epithelial tissues. And that's because these cats, think about this, if they're in the secretory tissues and glandular tissues, there's going to be a lot of excretion of infected viral particles in the saliva. These are these infective, transmissible cats. They don't have great immunity. They can't really neutralize and create antibodies. These cats, unfortunately, have the least favorable prognosis of feline leukemia. They have shorter survival times and they succumb to feline leukemia associated disease typically within several years. So kind of your cheat sheet is this on these exposure outcomes. The abortive is sort of best case scenario. This cat was exposed to an infected cat, but actually cleared the infection. So all that remains are those feline leukemia specific antibodies. The regressive means that they didn't really eliminate the virus and it integrated into the genome, but these cats have very low risk of transmitting this somewhere else, right? Because it's sort of contained inside the cat's genome. But if that second viremia happens, then we've got the cats that have the progressive infection. This is when we see those associated diseases because of feline leukemia. These are the cats that are shedding virus. These are these infectious cats. These are the worrisome cats, especially if it's in a group setting, if you're getting a new kitten. Again, blood donor cats should be in the regressive phase, obviously being tested, but certainly the progressive cats, we actively need to know their status because these are infectious cats for other negative patients.
Dr. Marks, real quick, Laura asks, how do we know if the cat is in regressive or the progressive stage?
We're going to get to that. Great question. Yes, great segue. We're going to get to that because that's where the confusion is. Exactly the point, right? We've got 3 stages of the same disease. How do I use a test to figure that out? Okay, so first we need to know who and when are we testing, right? Certainly, I think these are some scenarios, and the big thing I want to point out is whole blood is best here. But here's some scenarios that we want to think about. As soon as possible after adoption, and then hopefully 30 days after adoption. And that is not just kittens. Those are our adult and rescue cats. And if you're adopting senior cats too, it's really important because as we saw, one of the risk factors for these diseases, of course, is stress and the reactivation of virus or reactivation of a certain stage. Any ill cat we should be testing. It should always be part of our panel because remember, disease state for many of these is fluid, especially feline leukemia. And then before we vaccinate for feline leukemia, and this also applies when we talk about FIV. So we talked about, before we get into kind of the substages of testing, I think this is really important to think about. What other tests really support a diagnosis of feline leukemia? I would think that many of you are also running CBCs on these cats. And if you aren't, this is my plea to try to do that. In a perfect world, it would also be a blood smear. And the reason for that is this. In a younger animal or an older animal that we suspect, right, or we're testing for retroviral status, there's a couple things and pieces of the CBC that are very important specific findings that are quite supportive of a feline leukemia positive cat. And that is if we have a bimodal distribution. So it's we're seeing kind of a top and bottom, so to speak, of our reference range. And when I'm talking about specifically with our anemia, it's a non-regenerative or poorly regenerative macrocytic anemia. Now, if you're running something on an in-house analyzer and you're able to determine that just from the numbers, awesome. If you're you're thinking to myself, oh my God, I don't remember how to qualify that. You're not alone. I've been there too. And that's where having a blood smear or even digital cytology and having a clinical pathologist actually look at that and categorize it for you can certainly give you that supportive evidence. Sometimes we see a neutropenia. Remember, if we have bone marrow suppression, it's certainly suggestive of that. Or a lot of times we may even see an atypical lymphocytosis if we have some of the feline leukemia associated diseases like leukemia or what we would call myeloid or lymphoid or undifferentiated leukemia. Sometimes those cells are kind of just hanging out and circulating within the circulation. And that's why a blood smear is so incredibly helpful. Again, even if you're sending out to a reference lab, really, really a critical part and supportive evidence just to our quantitative values of finding that anemia and also a neutropenia. But the blood smear is again, looking for that macrocytosis, that non-regenerative anemia. That's even more supportive evidence if you're getting a feline positive on point of care. Now, discordant results are not surprising, right? And so if we look at this, which I think is a helpful, kind of busy diagram, but maybe helpful for you to understand. When we're looking at retrovirus, remember, again, this virus is actually going to enter the cell with RNA, and the reverse transcriptase, of course, is going to make the DNA from the RNA. The PCR is actually going to look for the production of those proviral particles in the host chromosome. But the ELISA test is actually going to look for new viral particles that are being made. And then the IFA can't tell anything what's happening in the cell. Remember, that's looking for antibodies. And that's really critical, of course, in our abortive infections, right? The ones that have cleared all that stuff, and then we're just going to be getting that antibody. So this is probably, I think, one of the most helpful slides. So feel free to screenshot. This is to our colleague's question who said, how do I tell if it's abortive, regressive, progressive? I'm in between. If you're getting a positive feline leukemia point of care test, right? You're doing this in hospital, and I hope you start doing more of it because we're certainly giving you some reasons to do that. This is how hopefully in the best way, you can start to think about how do I interpret these results. So if we go from the top, an abortive infection is going to be negative, right? And these cats are going to have a normal lifespan because remember, they have cleared the infection. All we have left are those neutralizing antibodies that have been produced because of the previous infection, right? Best case scenario. If we have a positive and we start to see either a positive point of care test on our 30-day recheck, or if we're starting to see that we're getting a sort of a decreasing positive PCR, and we'll get to the quant PCR in a second, those are regressive lifespans, regressive infections, which means we have probably a normal lifespan. Now, just a refresh, remember, regressive means that this cat is not actively shedding, right? It hasn't gone through that second viremia. It's not in those glandular tissues or the mucosa. It's integrated into the cat's genome. And that's why, remember, the PCR test is actually intracellular representation of what has been integrated, those proviral parts. So if we have a negative PCR or it's a decreasing PCR, meaning that it's sort of being contained, those cats probably will have more of a normal lifespan. And again, that's kind of second best case scenario. But if we have a progressive infection, remember, that's a positive point of care. It continues to be positive. We have a climbing PCR on our quant PCR. These are the cats that are progressive. That's worst case. Remember, those are the cats most likely to be infectious. Those are the cats most likely to have a shortened lifespan because they are going to probably succumb and have higher risk of those feline leukemia associated diseases. So hopefully this is a little bit more helpful for those of you that are like, oh, I need a little guidance and sort of a flow chart of how to make sense of this. Now, a lot of people will ask, and I think this happens quite a bit, right? I just had a kitten come in. This kitten seems totally fine, totally healthy. But all of a sudden, I do my point of care test and I have a positive feline leukemia. What do I do? Well, let's turn to Dr. Sam Evans and let's get a little bit of clarity on our next steps here.
So occasionally we'll get a positive point of care test, but a negative PCR, or a positive PCR, but a negative IFA. And what we know now is that that is part of the different course of disease in FeLV. It's part of the natural infection cycle that those things come and go. So really what's important is to retest these animals. If you get a negative test on point of care, but you're still highly suspicious this animal's ill, it has finding on CBC that are consistent with FeLV, we want you to retest in another 30 days, 60 days, and really follow these animals over time to really understand the infection. Same thing if you get a positive test in an animal of really low risk and you don't suspect FeLV, it's important to retest that animal because we do see false positives on point of care.
Okay, so is your mind kind of blown right now? And you're like, oh my God, I didn't realize all the nuances of feline leukemia testing. And yes, it is I get it's a little overwhelming. And I certainly over time have been pretty frustrated that there just can't be one test, right? It's either I've got feline leukemia positive cat or I don't. Well, here's the thing. Remember that it can take, and this is the reason that we have to keep these other tests in mind. It can take 30 days or longer for us to detect that P27 antigen. So if we're doing a point of care test and we have a negative, remember, it might just be too early, right? A recent exposure can yield a false negative. Or cats can be regressively or progressively infected or not positive for P27, but still infected. And there is some difference, of course, right, in what we just described on which test is going to be positive based on the state of life that cat is in, right, in the stage of the disease. So here's a little bit of a cheat sheet of sort of that algorithm of if this, then what, right? So let me kind of make this a little bit bigger so everybody can see. So you've done your point of care test or you've sent your test out to a referral lab for that feline leukemia antigen. If we have a negative in a perfect world, this is the easy part, right? It's just the hard part's convincing them to come back, is we want to retest in 30 days if there's been a high risk of recent exposure, shelter, group housing, a recent stressor, a change in status, right? The patients develop upper respiratory infection or some chronic diarrhea or something that makes them an ill patient, right? That's sort of the easy part. You get another negative, you kind of let it go for a bit. If it's a positive, then we level up, right? And then we have either our feline leukemia PCR, if your referral lab that you're using is doing a microtiter antigen, which is a much more specific narrowed focus on our antigen level, or IFA testing, remember that outside of the cell looking for antibodies. If that test is also positive, then we know the feline leukemia infection is confirmed, not necessarily fully defined yet, but at least we are able to talk to that client and say, yeah, we've got the virus, right? Now we can go into some of the nuances of the stages of disease and help that client understand why we're going to test when we are and sort of what that looks like. Unfortunately, don't kill the messenger. If we're negative at that point, the status is still a little unclear. And we may need, again, setting expectations with that client. We have to show them this information, right? Show them this chart, even show them if you want to go over that busy diagram of saying, look, complicated retrovirus at times, and there's lots of different, again, that fluid stage. We want to be able to categorize your cat to the best of our ability, but that may mean retesting or doing a CBC and looking for some of that supportive evidence or looking farther down the line at a different test, depending on, again, what budgets and clients allow. So again, I wish it was a little less complicated, but let's zoom in on that quantitative PCR because unless Matt, you have a question here. It looks like you want to jump
real quick.
in.
And there are lots of questions that people have, and we're going to do our best to get to them at the end. Dr. Marks will give out her email address so she can answer you individually. But one I want to jump back to real quick because I know we're moving on. Aiden was asking, what do you mean by confirmed but not defined?
Yeah, I know. So defined means is that at that point, meaning it's not defined is that it's not confirmed what stage we are in. We know that the cat has feline leukemia infection, but we can't completely 100% define which stage we're in. And again, that's why, Aiden, you've led me right into a beautiful segue here, or Matt, I guess, is that this is why the feline leukemia quantitative real PCR was developed, okay? And just by show in the chat, how many people are actually using the quantitative feline PCR test? Are people jumping in? I can't see the chat, unfortunately.
Yeah, all positive so far. It takes a second.
Is anybody using this, or is this pretty new to
Yes, no,
everybody?
there's lots of yeses, lots of nos.
Okay,
Hundreds of answers coming in. Oh, no.
Yeah, I figured. So remember, this is measuring the number of copies of that proviral DNA. So shoot your mind back to, again, the busy diagram, right? We know that the retrovirus goes in the cell, the RNA, again, with the reverse transcriptase, is going to integrate and make that proviral DNA. And that's the little section that this test was developed for. And basically, this is going to measure that number of copies and help clarify whether that patient has a regressive infection or a progressive infection. So look at the right side of the screen here. You see that feline leukemia positive cat. If they have a weaker immune response and they're not doing a great job sort of helping to fight off this retrovirus, this cat is going to shoot into a higher likelihood of the progressive infection. They have a high antigen load. They have a high proviral load. Again, that's what this is measuring. But if that cat's natural immune response is stronger, and remember, that's one of the risk factors, cats with weakened immune systems, then they have a better chance of shifting into that journey of the regressive infection, which means, if you go back to that flow chart, the Levy chart, they're going to have lower proviral loads or decreasing proviral loads and lower antigen loads because the virus is regressing, meaning it's going to stay sort of contained within that cat's genome, but we're not going to be to the point where it gets that second viremia, goes in those glands and secretes and becomes infectious. Okay, so this test, while not maybe one that every cat caregiver can do or authorize, and maybe not one that every cat needs, but as you're talking about how do we know sort of where we are, that's what this test is made specifically to look for. Am I in progressive or am I in regressive? And remember, progressive is the worst prognosis of the 3 stages. So why do we test, right? It seems like a lot to remember and a lot to go through because it really changes what we do. We don't want to put a feline leukemia positive, especially progressive cat in with a healthy kitten, right? For 2 reasons. One is we don't want to transmit to the kitten, but we also know that a healthy kitten may be harboring viruses that then can become opportunistic infections for that feline leukemia positive cat. So it's reciprocal. The same thing is we don't want to put a feline leukemia positive cat in with a cat who is feline leukemia negative, but maybe older or has a chronic disease, is immunocompromised, or all of the above, because they have a higher risk, again, of transmitting to that older cat with the weakened immune system, right? It's a risk factor. So very important for us to know that. It's also very important if you do get to those cats and you're able to go through and really, as accurately as we can, qualify a regressive cat, right? Remember that feline provirus was found in 2/3 of feline lymphomas. So what that means is that, like I said, this is a lower risk cat. This is not a progressive cat, right? Where it's the least favorable prognosis, but it's still in the genome and can still potentially reactivate. So this is one where if we've kind of gone through this scenario and they have very low proviral counts, right? And low antigen counts, we want to educate these cat caregivers and say, here's where we are, but it's incredibly important that we continue to monitor your cat's viral status for these reasons. High stress levels can potentially reactivate. Sometimes these cats, even without high stress levels, it's low risk, but they still can reactivate and become lymphoma. So really critical, especially understanding the lymphomas from this are most commonly diagnosed between the ages of 9 to 14. We have a hard time getting cats in middle age often to come back, right? This is one of the reasons they need to come back, because these cats should have frequent retroviral testing, especially in this quant PCR, so we can make sure that their loads are decreasing and staying low. Because if you start to see those trends going high, those proviral loads getting higher, that makes me more worried that that's one of those cats that is going to reactivate. I'm sure there's still lots of questions, but because of the sake of time, I got to keep going here. We'll hopefully get to more in a bit, but let's shift into FIV. And I think there's some questions about this. Let's see how everyone's feeling as we change diseases.
Yeah, poll number 4 is about concerns with our FIV positive cats. What are you most concerned about? Is it upper respiratory infection? Is it dental disease? Is it poor wound healing? Or is it transmission to other cats? And Dr. Marks, I imagine with all of these, a big thing that becomes part of this is client communication.
Right. And certainly as we talk about retroviral status, hopefully everybody is feeling maybe a little more comfortable about leukemia, maybe not. Maybe I've just opened a can of cat worms here. But with FIV, I think there becomes sort of this sort of complacency. It's like the lesser of two evils, right, between feline leukemia and FIV. And thankfully, with all the advent of HIV sort of education that's come out, we know that FIV is not the death sentence that we originally thought it was, right? The same thing that's happened in human medicine. However, we do need to recognize these cats because they are at risk more of upper respiratory infection and dental disease and poor wound healing. And they can, if they are outdoors and at risk of bite wounds, transmit to other cats, because these are the things that clients need to be aware of so that they can be proactive at home and alert us if something's changing and not be so questionable when we're recommending potentially more frequent dental prophies and dental radiographs to really control the things that are going to set these cats off. What's everybody thinking at home?
Well, some people in the chat are saying we need an all of the above option on this, and that would
Love
be their
that.
vote.
That's my fault.
For people that were willing to choose, transmission to other cats, most important with 41%, followed by dental disease at 27% and upper respiratory at 23%.
I'm with you. And I love the fact that people are saying all of the above because, yeah, certainly it is all of the above. And I probably should have given a fifth option. But I'm glad to hear that people are thinking about all different things. And it's probably depending on the cat, maybe a different priority. If you see a cat with a horrible periodontal disease, maybe you aren't necessarily talking about poor wound healing. But if that cat's going to undergo surgery, we certainly want to talk to them about this, a higher risk that we have to watch this wound carefully. And that's why I'm prescribing antibiotics. So we're going to go through, and this slide might look a little familiar to you, right? It looks very similar to the feline leukemia, but two things that I want to point out that are different here, two noticeable differences. With feline leukemia, remember, we are testing for that P27 antigen. But with feline immunodeficiency virus, we are testing for antibody. Two distinct differences, right? The other thing is that if you see the testing guidelines and timing, with feline leukemia, we can see that P27 antigen positivity after about 30 days. For FIV, it's about 60 days. And then instead of testing in 30 days again, we do 60 days. So it's a little bit longer time. It shouldn't be that surprising to you when we think about antigens versus antibodies, right? Because antibodies need time to be produced, right? The antigens have to be there. The body has to make the antibody, and then we can recognize it. So hopefully that keeps those two straight in your mind. Remember, antigens first, antibodies second. It's a shorter time frame for P27, and with FIV, again, it's antibody testing. Also, a very similar life cycle slide here. There are a few phases of FIV. It's thankfully not as scary as feline leukemia, which is why I sort of got the hardest, second hardest one out of the way in regards to retrovirus, but let's sort of go through this step by step, okay? The acute phase, after a cat is infected, an infected cat, of course, is shedding in the saliva and typically transmit this through fighting and bite wounds. We can see the acute phase, and that's when a a lot of times it's kind of, to be honest, when we're triggered to test. There's a transient mild fever. Typically, these cats get some form of an appetence all the way to anorexia, but it might just be hyporexia, a decrease in appetite. And they can have lymphadenopathy even for 1 to 3 months. And if we test these cats at that stage, we typically will see antibodies positive. But remember, just like with feline leukemia testing, if that infectious exposure happened last week and we test, is that going to be long enough for antibodies to be produced? No, and that's why it's very important for us certainly to make sure that we have good histories of exposure and understanding, again, how we educate our caregivers of the disease course so that they understand when we're recommending for them to come back, this is why, right? So again, this is sort of that acute phase. The next part of this is the asymptomatic phase. And this is the tricky part of it, because this can last for many years. And I'm sure many of you have had cases where all of a sudden you have a cat come in that comes in that's 10 and it's FIV positive. And you're like, I saw this cat at age 5, right? And nothing was going on. This, again, is part of this disease state. And there's an increased risk, though, during this time of chronic and recurrent infections. So maybe this is a cat that when you look back at the history has, maybe it's from this first time you're seeing it, but you look at the medical records and sort of waxing and waning diarrhea or waxing and waning upper resp, or it's just always had horrible gingivitis and never really been explored, right? These are the cats where I worry that they're potentially in the asymptomatic phase. This is also a time where neoplasia is 5 times more likely. So this is because we have more cell-mediated immunity. Remember, just like in the human disease, the CD4 and CD8 are activated, and we can also even see a high globulin count at this stage, not to be confused with what we're going to talk about before. That might occur, not as highly pronounced, certainly as FIP, but they can still shed virus, but many of the cats, thankfully, don't progress beyond this phase. But the clinical phase, this is one where I think when this disease first came out, this was the most commonly looked at stage. And there's a lot of things that we see during the stage, like chronic gingivostomatitis, chronic rhinitis, a lot of lymphadenopathy, glomerulonephritis. We can see weight loss. We can see all forms of neoplasia, including lymphosarcoma, squamous cell carcinoma, viral disease, fungal disease, parasitic disease. I mean, you name it. This cat is basically like this open book saying, if you're an infection, come on in, the party's open, right? So these are cats that are at high risk and certainly are going to be testing positive during this time frame. But a lot of people are asking, as we've talked about this, why can't we use antigen testing, right? Why is it antibody testing? It doesn't seem to be as specific as the feline leukemia testing that we have available to us. And that's because of this. As we look at this, antigen testing is for active viremia. That's when it's most helpful, and that's in feline leukemia patients. FIV patients do not have constant active viremia going on. They don't have antigen floating through their bloodstream. So we wouldn't be able to pick it up even if there was an antigen test. And we also know that with feline immunodeficiency to virus, or FIV, the viral load in the blood drops after 2 to 3 months, circulating just as provirus. The intact virus is no longer in the blood. So remember, and this hopefully will be helpful, and again, somewhat similar to the feline leukemia, just thankfully not as confusing. If you've done that point of care test, and just like with leukemia, we have a kitten that shows up FIV positive. Remember, it's antibody, and typically after 60 days. If they're negative, just like that first diagram showed, we want to retest in 60 days, especially if there's been a high risk, there's a previous bite wound, a previous access, there's an outdoor cat, shelter cat, unknown history, all of those scenarios, we want to retest, or if you suspect it was too early when we first tested. If it's an FIV positive test on your point of care test, the next step, not surprising, is a PCR or a Western blot or even another point of care test. And thankfully, we're just yes or no, right? On that second test, if it's confirmed, it's FIV. If it's negative, it's a little more unclear, but typically more on the negative status. But if it's a positive, we can feel very good. It's a confirmed, and we don't have to think about substaging this disease. So again, FIV, a little bit more clear. There's still some nuances there, but the big thing to remember with this is that we're antibody testing. We're waiting the 60 days. And if we have a positive, we can do PCR or Western blot, usually sent out to a referral lab for confirmation. And if we have a positive, it is confirmed. Now, with the time we have left, we're going to jump right in to feline infectious peritonitis, which I'm sure everybody's been sort of sitting on the edge of their seats for. When I was in school, unfortunately, I was taught by one professor, FIP is RIP for cats. And I always was just devastated learning about this disease because we had really no diagnostics, we had no treatment. It was these young cats that just, died very awful deaths. It was just really depressing for me to think about. So hopefully I'm going to be a little beacon of hope for those of you that are looking for some new information tonight. But first and foremost, let's hear a little bit about how everybody's handling this at home.
Yeah, we're going to launch our last polling question of the night. What test do you use to diagnose FIP? Is it response to treatment, serology, fluid analysis, or mutation assays? Dr. Marks, real quick, I want to say for everybody here tonight, if you're not already part of our PYP program, when you get the follow-up email, you will get a link to join us. There will be the QR code again at the end of the night. But if you're enjoying the presentation, if you're enjoying hanging out with Dr. Marks, I want to bring it up now real quick because I'm enjoying so much the community that's going on in the chat, all the comments and everybody sharing what happens in their area. And that's what PYP is. It's really Perfect Your Practice is about building this little community to give you all tips and helpful ways to just do better for your cats in practice and make your life better and make your clients' lives better. And you get an email from Dr. Marks once a week, just with a quick video, some quick tips, just like we have from Dr. Evans tonight, things like that, that just help you in your week, give you a little quick tidbit, some links to share, different stuff like that. It's real easy, it's free, and it's simple, and it just jumps in your inbox every Tuesday. So we'd love for you all to become part of our PYP program. Dr. Marks, as everybody is finishing up answering, there's lots of testing options. So the question is, are they all good options?
Yeah, and the theme of the night, right, is it's a fluid state. And we're sort of looking at that patient and also looking at what that cat caregiver can afford and what that cat caregiver can authorize. And I guess what I want to leave before we dive into these tests is education and knowledge is power. Not just for us, and that's probably why everybody's on here tonight, because these are, even though we commonly mention these diseases, the nuances of these diseases, either we didn't learn, i.e. 20 years ago, because we didn't know them, or we forgot, or they're, it's sort of overwhelming to kind of decipher these. So as we go through some of these tonight, the hope is that you can understand why I would use this, or when I would use this, or if the client says, I just can't afford this, what's the next best option? You'll have a better sense of that. What's everybody thinking?
Well, fluid analysis is dominating with 58% of the vote so far, followed by serology and response and mutation are single digits.
So maybe I don't even need to go through this next section. No, I'm just kidding. That makes me so happy that everybody's sort of leading us in the right direction already. But let's kind of go through this because, again, for a lot of families, not just veterinary teams, right? A lot of families, FIP has just been this like heavy weight of death sentence, right? And so as people have come together post-COVID, and as you'll sort of see in a second, there's been hope. And I think that's the sort of the theme of this last section is that FIP is no longer always a death sentence. FIP is no longer this enigma of how do we even find that this is FIP until we do a necropsy. So as we go through this, let's kind of go, section out some of these tests we mentioned in that poll and why there might be value and maybe not, right? So the first thing is, of course, is there any value for serology with FIP? Thing is, as everybody knows, right, almost all cats have some antibody in their bloodstream because coronavirus is non-specific. And if you are simply using titers as the way to diagnose FIP, unfortunately, there are an increased number of false positives that way, even with high titers. And a low titer does not rule out FIP because there's false negatives in cats that have young, very immature immune systems, or they have very low levels of the virus already in their body. And this is even scarier, right? Around 10% of cats with FIP have negative titers. So if this is, at least up until tonight, if this was the test you were using, we have some opportunity to hopefully share some tests that are going to be better outcomes for you and feel better about the ability to talk to clients about some other testing that is going to be a little bit more helpful for you. Now, I'm curious, Matt, and let me know in the chat, how many of our community tonight, how many members are using mutation assays? Let me see if anybody's coming in.
Well, in the poll, it was 4%.
4%. Is anybody
the diagnosis?
Yeah, anybody throwing in the chat? I'm curious to sort of hear if you are using it, what you're feeling, what's your experience been? Because a lot of companies are coming out with mutation assays, and what they're doing is they're sequencing or developing a PCR test for mutations in the spike protein of the S gene of the virus. And while they're great in theory, unfortunately, they're not really consistent in the real life testing. They're going to miss some true cases of FIP, they're going to overdiagnose others. And so the theory, unfortunately, doesn't translate into the real active viral mutation. And a lot of healthy cats can even have circulating virus. So PCR is a really important diagnostic tool, but the mutation assays specifically don't add a lot of diagnostic power to it. So while it's out there, I would say if you have a client, especially who's working on a budget, the mutation assay would not be the first thing that we would choose based on some of the field studies currently.
And we only had a couple of yeses, a lot of no's, and a couple never even heard of it.
All right. So again, note it's there, kind of keep it on the back burner. I'm sure it will be perfected with time, but right now would not be my primary choice. Now, we had right in the poll, this was our #1 selection, the fluid analysis. I'm so glad you're on this train. Let's hear what Dr. Evans has to say. She's got a couple little tips in here and one big pearl about albumin to globulin ratio I want you to remember.
So complete fluid analysis is something that we really want to prioritize. Of all the diagnostic tests that we have available, it probably comes closest to being the test for FIP, although none of them are perfect. So you really want to do the imaging, find the fluid, and get a sample if you can. Run the complete fluid analysis, which includes cell count and protein content. The protein content of these fluids are generally quite high, and the cell count's relatively low. So they're classified as a high protein transudate or a modified transudate. That's really classic for FIP. They also have really high globulin content relative to albumin. So that AG ratio that we run is typically low. So an AG ratio or albumin globulin ratio of 0.8 is considered the most sensitive for FIP. It's also relatively specific, so it's a pretty good test. If you get an AG ratio less than that, you can increase your confidence substantially that you're dealing with FIP. So that's why we really want to prioritize finding the fluid, running that complete fluid analysis, and asking for an AG ratio.
All right. So we'll keep those pearls in mind, right? So the drum roll, I think what everybody's been waiting for the unveiling is sort of what's this GS441524 that I've heard about, right? And so I want to be very, very clear before I start talking about this, is that this is still an illegal compound in the United States. And so what I'm going to talk about in the next few slides is strictly informative of what's been talked about in the literature thus far. If you want, and as you know, of course, tonight we're doing a whole dive on all the retroviruses, but if you want to learn more about this, you can certainly reach out and we'll give you resources, because this is really on your own to do your deeper dive and exploration. I want to introduce, though, what this is and certainly the study that this came from, so that you're aware, again, of what is available out in the literature. So again, there are no approved veterinary drugs available in the US. However, if you're very familiar, it sounds like our colleague who's been certainly researching this, who's been treating cats in DC, but there was a Facebook group, peer-to-peer coaching group that was developed, and the impetus was cat owners who were dealing with this disease. And there is again, this compound GS441524 that is in the form of injection or pills with a pretty hefty price range, as you can see. That was part of this Facebook peer-to-peer coaching group that, again, cat caregivers back and forth were sort of discussing outcomes and talking about this compound together. The reason that this became sort of a heightened awareness was because there was a study that was done in 52 shelter cats with this, The important part of this study looking at this was because they were really interested, as I mentioned before, one of the risk factors for FIP, remember, was big and bolded, was retroviral status. So they're looking at how do these cats do in this study with GS 441524 if they were feline leukemia negative versus feline leukemia positive, and again, looking at comorbidities. And they found in this study that mortality in the first 4 days of treatment what might have been influenced by either the patient being in a critical or unstable condition or these comorbidities. And after 4 days of treatment, if there was mortality in this study, and you see here, it was influenced a lot of times, again, by feline leukemia status, a positive status, and associated anemia or lymphoma. Again, those feline leukemia positive associated diseases. What do we take from this? Some of these conclusions is 91% of the cats in this study, again, these shelter cats that survived 4 days of treatment recovered. Obviously, that's an optimistic study finding. Cats with feline leukemia had nearly the same response to treatment as those that didn't. And the study group, again, the research paper conclusion was that this was a practical and effective thought process for shelters and rescues. So the future directions, this study sort of was projecting, again, future goals, is that this would be a kind of a foundational way to start thinking about standardizing shelter diagnostic protocols. How in the future are we going to have access to approved drug sources? How in the future are we going to understand dosing requirements for those cats that also have concurrent feline leukemia? What's the follow-up look like? How do we reduce the shelter-associated risks for FIP development? But most importantly, and I think all of us as practitioners and technicians really want, is more awareness and optimism for treating FIP. So as, again, this is strictly informative to get you to understand the study, and certainly please do the research on your own, because this is still, again, we do not have a legal compound in the US or approved compound, but based on this study, their treatment protocol was as such. If the animal was feline leukemia negative, this cat was treated in the dosages. And again, feel free to screenshot or reach out to me afterwards for the full study. If the cat, though, was feline leukemia positive, you can see that in this study, they definitely increased the dosages based on if there was an effusive form, a dry form, or if the cat was not responding. And then there were dose adjustments done. In this study, there was an injectable form started for those cats that had effusions or were critical. They did increase in those shelter cats to 15 mg per kg, which is a significantly higher dose if they weren't responding, and then either decreased injectable to once a day or even changed to oral as they started to stabilize. So again, please investigate on your own. It's certainly exciting to hear that the research continues to move forward with FIP, but tonight's introduction was truly to be that, to really introduce you to the compound, introduce you to the study, and have you do some more deep dive on your own. And finally, I know as we're winding down here, I want to be able to get to a few questions. Just why do we talk about all this? What is the core principle behind retroviruses? We need to know how to test. We need to know the stages of feline leukemia. We need to know how to differentiate between progressive and regressive, and that we're testing for antibodies with FIV, and that fluid analysis is best for FIP, at least right now. But the core principle behind this is prevention, as much as we possibly can. So AAFP has a great guidelines here, and I just want to point out, I think, 3 pearls that are probably what I take from this, most importantly. The first is notice that our FBRCP series starts at 6 to 8 weeks of age. We continue to booster until 16 weeks, and then we should do a vaccination booster at 6 months of age. Are we all doing that? That's hard, right? Because not every cat that we see needs to come back for a spay neuter. A lot of them are already shelter spayed or neutered. How are we educating? And that certainly we can hopefully get into a little bit more. And then, of course, we're doing the every 3-year protocol. Feline leukemia, I'm sorry, rabies. As we look at the rabies, we're vaccinating at 16 weeks. Don't forget that we need to do a 1-year booster at that 12 to 14 months of age after the first vaccine. Then we can switch to 1 to 3 years, depending on the protocol that you're choosing. And again, these are AAFP guidelines. the vaccination guidelines on catfriendly.com. But finally, most importantly, and I think this is, if you don't remember anything else, hopefully you'll take this home. Feline leukemia vaccine is recommended for all kittens, as well as the 1-year booster after the last dose. And why is this? Maybe it's not a forever vaccine, right, for every cat. It probably isn't for a lot of cats because we're looking at their lifestyle and we're looking at risk factors for these cats. But it's so important that we help these cats create those initial potentially life-saving antibodies because their lifestyles can easily change. Cats escape out the door, cats travel, cats have catios, people rescue cats, people take in stray kittens all the time, right? There are risk factors. And so we want to make sure go back to your hospitals, talk to your medical teams, think about what does our protocol really look like? How can we make sure we're giving these kittens the best chance if their lifestyle changes? And last thing before we get to questions is I just want to make everybody aware of the AAFP handout, which is awesome for feline leukemia and FIV. That AAFP, this is a downloadable one. You can see at catvets.com/guidelines/client brochures. If we don't have time in every visit, which we know we don't, this is a great supplemental handout to either have on your website or send your clients to, or have printouts out in kitten visits. It takes a lot of that supplement because we know, of course, that 40 to 80% of what we say in an exam room is forgotten the moment they leave the door. So keep this in mind to help supplement what you're teaching. I'm going to leave this up for a few minutes as we talk through questions, and the next slide will also have my email. So if we don't get to your question tonight, please feel free to reach out to me. I know this was a ton of information for 1 hour. We probably could have done it over 3, but we wanted to at least expose you to some of the nuances of diagnostic testing and certainly to introduce GS 441524, as well as to sort of get some exposure to what everybody's seeing out in the field. So Matt, I'm going to turn it back to you and see what kind of questions we can answer.